Hello and welcome again. I am Marissa Lavin. I'm a mom, I'm a homeopath, and most importantly, I am a curious human who continues to free myself from fear-based stories by reconsidering everything I thought I knew through this beautiful lens called Syntropy. What is Syntropy? Syntropy is, most simply put, it's a perspective that is guided by nature. In my last video, I reconsidered the concept of illness. And I shared how I was trained to relate to illness in my public health background, and then also from my own personal struggles with frequent illness. The relationship I developed with disease was one of prevention. I wanted to avoid illness, and my whole health strategy was built around that. So in more recent years, I have begun to connect more with nature. And I look to nature to see how my relationships with that, relationships that essentially influence how my life turns out. I see how they measure up to how nature relates with those same things. So as I said, Syntropy reflects nature's perspective. It's one that's powered by the energy of love. And in Syntropy, there's this awesome concept that I absolutely love, and it is this, that everything in life is performing a function with purpose. So this week, I am again inviting my friend Sovereign to join me. He is our syntropic sage, and I'm going to invite him to chime in here and there with his thoughts. So Sovereign, you want to jump on in? Hi.
Hey.
From
Nice.
beautiful Bali again.
Yes. So great to be here.
Yeah. So we have an intense topic tonight, and I have a lot to cover. So I'm going to go right in, okay? So actually, Sovereign, you and I discussed last conversation that in nature, you don't see the energy of prevention. It doesn't exist. Mm-hmm. And dis-ease in nature is allowed to happen. And then it was so interesting because you mentioned that it leads to this super adaptation that leaves the system more resilient than it was before.
Yeah.
And I find that fascinating because it really makes you stop and think and reevaluate all of the things that we feel compelled to do to our bodies to avoid something that is perhaps meant to make us stronger. Mm-hmm. And yeah, so I could really just go there, right? We could just go into all of the things we do for prevention and then what we would do instead. But before we do that, I actually thought this week I really want to explore more specifically where this idea of prevention comes from. What are the beliefs that we have subscribed to that have us believing that we need to avoid disease? Mm-hmm. And then, in effect, possibly limiting our ability to use disease as an experience that is a strengthening opportunity rather than a suffering or a weakening event. Now that is, I know, very different than, perhaps what we're used to hearing about disease and illness. And I'm certainly not taking disease or illness lightly, but I'm really going to dive in tonight and challenge this whole concept, the beliefs that underlie our need to prevent, to avoid. So today's conversation, we're going to reconsider the idea of the roots of how disease spreads, what we believe about how disease spreads. And I'm going to share some interesting evidence that I have found. And then I'm just going to share the opinions that I've developed. These are my opinions. They do not have to be yours. I'm going to remind you guys of that over and over. But yeah, I'm ready. You ready, Sovereign? Okay, awesome. All right, so what's the prevailing story about contagion? I'm just going to share a snapshot of mine. This is what I would think about it. All right, I'm sick. Who gave it to me? Who was sneezing or coughing around me? Did I forget to wash my hands or put on hand sanitizer when I was leaving that public place, the gym, maybe? I bet my kids brought it home from school. The classroom is like a petri dish, on and on, right? Now I'm going to pass it around the whole house and I'm going to be, there goes my productivity for the next few weeks. That would be the way that I would relate to an acute illness event. So I feel like I've been coaching people and helping people in their health for a very long time, for over 15 years. And I've heard some version of this over and over. So I feel like this is like a societal underlying belief. And essentially the point is this, right? That disease spreads from one organism's droplets or biological material to another. And that disease is primarily caused by some kind of germ inside those droplets, right? Somebody's germs get passed to me, I get sick. So here's the question tonight. And this is the question I asked myself before I dove in and did some research. So is that absolutely true? Is it unequivocally scientifically proven? That is the question of tonight. Well, I would think so, right? I mean, everybody agrees with this. Even alternative health, in my field now, I've kind of stepped out of my conventional health background and I work in the alternative health space as a homeopath. And that same story prevails in my field. And, I just feel like as a whole, we, assume that a virus or bacteria or some kind of opportunistic germ causes infectious disease, and that those diseases are caught through some kind of contact. And, in science, obviously, we call this a hypothesis, right? And a hypothesis is essentially a research question that is formed and then tested. And there are two main ways to test a hypothesis in the health sciences, for example. So one, and this is right from the textbooks. So one is an experimental study where I directly test that particular question. Another is an observational study where it's more of an indirect measure where I measure trends, I collect data, and then I calculate and draw inferences. So experiment is actually far more valued, but it's much more rare. It's expensive. But let's just imagine. So here's what I want to do tonight. I would really like to explore, like, if we were to do an experiment to test this belief, does disease pass from one organism to another through physical contact? How would we design it? And let's pretend we have a hardy budget. So we're going to do an experiment on this idea. So first thing, we would need test subjects, right? We would need those who are clearly infected with a specific disease, and we would want to pick one particular disease just to make sure we limit confusion and for more consistency. And then we would need healthy subjects, right? So what are some of the ways that we can directly expose the sick to the healthy to see if the healthy get sick from that direct exposure? So I actually came up with some ideas, and I'll mention them here. And if you get a little squeamish, then you can maybe mute me for just this 2 minutes. Okay. All right. So let's say we take a purified sample of the germ, right? The germ that we think causes this illness, and we stick it into somebody's orifices, like nostrils or eyes or throat. So that would be one way, right? Then we could take a sample. We could also take a sample from the lungs of an infected, autopsied body. And we could take that stuff and we could spray it into the nose, the eyes, and the throat while the healthy subjects breathed in. Gross, I know. All right, so then another way, so those are two methods so far. Well, another is to spray directly into the nose, throat, and eyes the mucosa from the nose, throat, and eyes and bronchi of a fevered, infected, alive patient with this disease. How about transferring the virus obtained directly from the secretions of the mouth, nose, and throat and bronchi from a living case, a living sick person with this disease, and then spray it into the nostrils, throat, and eyes, okay? Then we could also just like swab the nose of the sick person and put it into the nose of the healthy person, or throat to throat. I know, super gross, sorry. How about that? Okay, so let's just say that those are the direct exposure. How about if we inject the blood of the diseased person into the healthy subject, or the biological material, so just the mucosa from somebody infected, and mix that into a solution and inject that into a healthy subject? Okay, I'm done being gross, I promise. It's over. You okay? You're still with me, Sovereign? Okay. All right. So, yuck. I know. So, I didn't actually make those up, by the way. Has this study, have these actions that I mentioned, have they been done before? And actually, I'm so glad you asked because yes, they have. There is a study where all of these things were done and more. And this study that I have right here, okay, this was published in the Journal of the American Medical Association in 1919. And it is entitled Experiments to Determine the Mode of Spread of Influenza. And it was the director of hygiene who commissioned the study from the US Public Health Service. So this is like super official stuff. Put together this amazing team, and they actually conducted these experiments simultaneously in San Francisco area and in Boston area. And they had really actually a perfect set of subjects for this because they used a naval base, actually the quarantine station in the actually Gallops Island, which was in the port of Boston. So they had these healthy subjects and they would go over to the naval hospital. And at this time, this was during the Spanish flu of 1918-19, right? So I think most of us at this point have heard of that, but this was one of the most enormous epidemics of influenza that the world has ever seen. And this was right in the heart of it when they were doing this study. They were trying to figure out what was going on. And just, you know, in the words of the researcher, that, you know, he was actually pretty sure that you know, there's a physical passing of this disease, but he just wanted to test it, just wanted to like understand more about it. So what was interesting was all of those things, those gross things that I just mentioned, were done. And they had 100 healthy subjects, and they would basically draw a few of these incredibly brave, okay, I might add, you know, just military guys who offered themselves up to basically breathe in, be injected with infected material from newly sick patients, like patients who had been just diagnosed and were in the throes within a few days, a day to 2 or 3 days of this influenza, and in the middle of an outbreak. Because influenza at the time, there weren't very clear criteria. Actually, even now, you know, the criteria are very general. So it's difficult to isolate whether or not somebody had influenza. So they would take them only, the patients could only come from like an outbreak of this. So it really seemed to match up with the description of this particular infectious disease. And every single one of those 6 different ways that I mentioned, not one healthy subject became infected from exposure, direct exposure to the sick person, from the sick person. Now, I don't know that such a study would ever be done again, because after this, after like 1920 was right around the time when public health in the United States became really institutionalized, and there were a lot more rules and, you know, kind of patient advocacy, and we all have to be HIPAA certified, and, you know, there are just certain, you know, things that you just do not do because you don't want to put the subjects, the healthy subjects or the controls, you don't want to put them, or the experimental group, you don't want to put them into any danger. But these guys were pretty bold. They did not worry about that. So here's what's interesting. They did these experiments, and then they didn't have any positive results. So they thought, all right, well, we have to, you know, keep trying. So they, after the injection and all of that I described, the next experiment, I'm going to read directly from this. The next experiment was designed to imitate the natural way in which influenza spreads. And I have no doubt, this is the author of the study, the director of hygiene at the time in the United States. He said, I have no doubt it does by human contact. So this guy's like, I know disease spreads this way, no doubt in my mind, but I need to test it. This experiment, so he brought 10 of their healthy volunteers from Gallops Island, so from the quarantine station. He brought them to the Naval Hospital at Chelsea, okay? And then this is basically what they did. So they had these 10 guys who went into the like bedside of newly infected patients who were sick in bed. And here are the methods. You ready to hear the methods, Sovereign? You guys ready? All right, so A volunteer was led up to the bedside of the patient. He was introduced. He sat down alongside the bed of the patient. They shook hands, and by instructions, he got as close as he conveniently could, and they talked for 5 minutes. At the end of the 5 minutes, the patient breathed out as hard as he could while the volunteer, muzzle to muzzle, in accordance with his instructions, about 2 inches between the two of them, received the expired breath, and at the same time was breathing in as the patient breathed out. This they repeated 5 times, and they did it fairly faithfully in almost all of the instances. I love that, fairly faithfully. The poor healthy subject was probably like, okay. All right, so then after they had done this 5 times, the patient coughed directly in the face of the healthy volunteer, face to face, 5 different times. And this particular healthy subject then went to do this 10 different times with 10 patients. So one healthy subject was exposed to 10 different infected patients, talking for 5 minutes. Hey, shake hands. How are you? And then, okay, you breathe out. I breathe in 5 times with us 2 inches apart. And then you cough in my face 5 times. Okay. Okay. On to the next one. So that's 50 inhales of sick stuff and then 50 coughs in your face. And then this I love. This is my favorite part of the study. I may say that the volunteers were perfectly splendid about carrying out the technique of these experiments. They did it with a high idealism. They were inspired with the thought that they might help others. They went through the program in a splendid spirit. I mean, seriously, like courageous people here that are like, they were, thinking that they're making such a difference, and they're trying to help. And this is fascinating, So anyway, interestingly, none of them got sick. None of them took sick in any way. So the study goes on. I don't know. I don't need to go into the entire thing, because there was one instance. So they took a break because they were like, we cannot figure out how to pass this thing. I mean, we've tried like 8-10 different things and we can't figure out how to do it. So they took a break for the holidays and they came back in February and March. And what they actually did was, and this is super interesting, they ended up taking the healthy subjects, or a group of them, to this naval prison in Portsmouth. Okay, so they changed locations. And I emphasize that because if I were to analyze this, I don't see the researchers doing this, but this would have been an important piece of information that I would have evaluated. Half of the patients that did some of these experiments, or the healthy subjects, got sick in this prison. Okay, not in any of the other trials that they did, but when they went to this physical location, they started presenting with sore throat and some symptoms of actually strep. So then, this is the conclusion of the study. So the researcher says, I think we must be very careful not to draw any positive conclusions from negative results of this kind. Many factors must be considered. Our volunteers may not have been susceptible. They may have been immune. So back then, natural immunity really was held to very high regard, okay, back in 1919. So he's basically saying if they somehow had the illness, and in our questioning, and they thoroughly question these guys, I mean, they go into the methods earlier on, they missed something and they had natural immunity. But what's interesting is Dr. McCoy, another researcher in San Francisco, did the exact same methods over in out in Goat Island in San Francisco, and also had negative results. They were not able to make anybody sick. So, Saffron, you want to chime in? I have more, but this is just one of my pieces of baffling information that I happened to come across when I looked into how disease spreads.
I love it. Well, what is there to say? That's pretty hard evidence, and so a lot of it is really based on our perception, isn't it?
It seems that way. And remember, this is one study. So I have a public health background. There's no way you would ever draw conclusions based on one study. But here's the interesting thing about research. The burden of proof is not on the disprover. It's on the prover. Like, you have to prove something that then cannot be falsified. So if we're to say disease definitely spreads if I cough on you and it gets in your eye, that cannot be proven false. And it's not proven false here, but I don't know of any level of this. I don't know of any study that has ever been more thorough than this. In fact, this kind of study wouldn't even be done. Like, it wouldn't be allowed. It would be considered risky. So what I'm trying to point out tonight is, I'm not saying that this is not true, that disease passes from one person to another through droplets. It's that maybe it's time to question it, because it just seems like there's some serious, holes perhaps in this theory, right? And we're basing everything that we do in acute illness and infectious disease on this premise, right? So here's some more. You ready for some more? Yeah?
Great.
Okay.
Lead us on.
So there's this really cool book that if you guys get a chance to read, it's called The Invisible Rainbow. And I love this book for a few reasons. It's written really beautifully. It's very interesting. But it also, if you go in the back, it has 100 pages of a bibliography. So what this means is that this amazing author, Arthur Furstenberg, he did some really thorough research. And if you look into his references, they're really varied and interesting. Like, some of them are news articles. He went into archives during various time periods throughout history to see, what people were saying. He read letters. It wasn't just like news articles and like, a search engine search, right? So interestingly, influenza, okay, which is the most common infectious disease. That's why I'm using this one. This is what my resources pointed us, me to, and it's frankly the thing that plagues us the most in modern infectious disease. It's the one that hasn't been resolved, right? So influenza historically used to happen in waves. It would happen every few years, sometimes every few decades. And until 1889. So, and I'll just read real quick. So, since ancient times, influenza had been known as a capricious, unpredictable disease, a wild animal that came from nowhere, terrorized whole populations at once without warning and without a schedule, and disappeared as suddenly and mysteriously as it had arrived, not to be seen again for years or decades. It behaved unlike any other illness, was thought not to be contagious, which is interesting, and received its name because its comings and goings were said to be governed by the influence of the stars. That's how influenza was named, influence of the stars. Isn't that interesting? So there's another little interesting anecdote. So there were pandemics of influenza that would be over within a few days, before there was air travel, before there was any way for that particular infectious organism to physically travel on a living organism to be passed to another. And what was the most interesting example of this were actually ships at sea. So, for example, here's one story, is that this merchant ship, the Wellington, had sailed with its small crew from London on December 19th in 1891, and it was bound for Lyttelton, New Zealand. On the 26th of March, after over 3 months at sea, okay, so they left London, were at sea for 3 months, the captain was suddenly shaken by intense febrile illness. Upon arriving at Lyttelton on April 2nd, the pilot coming on board found the captain ill in his berth, and on being told the symptoms, at once said, "It is the influenza. I have just had it myself." So this guy in New Zealand had it, and this captain just randomly out of nowhere, after no new exposures, he's on a ship for 3 months with the same people, and he gets influenza, same illness. Another one, 1857, okay? The English warship, the Arachne, was cruising off the coast of Cuba without any contact with land. No less than 114 men out of a crew of 149 fell ill with influenza, and only later was it learned that there had been outbreaks in Cuba at the same time, and they were not exposed. They were not physically exposed. So these are just two little stories. There are so many more in here. But why am I even sharing this? So there's this quote. This MD in 1976 was putting together kind of a compilation. There's a bunch of interesting books about influenza. This is not a new topic that's been studied, but here I love this one, that before 1918, there are records of 2 other major epidemics of influenza in North America during the past 2 centuries. The first of these occurred in 1789, the year in which George Washington was inaugurated president. The first steamboat did not cross the Atlantic until 1819. Okay, so like 30 years later. And the first steam train did not run until 1830. Thus, this outbreak occurred when man's fastest conveyance was the galloping horse. Despite this fact, the influenza outbreak of 1789 spread with great rapidity, many times faster and many times farther than a horse could gallop. So, another just kind of interesting take. And I have one more, if you guys can hang in with me. Can I share one more?
This is so great. I'm just taking notes here. This is my new objective.
Oh yeah, and these are just my favorite. I have a lot. I have like 4 or 5 books over here. So this one is really interesting. This is more recent because now I'm in love with syntropic agroforestry and all things nature. So here's this really cool, interesting tidbit coming from nature. Rain-making microbes, okay? Microbes being microorganisms, living organisms that are microscopic, right? So listen to this. Microbes are everywhere, including in the clouds. Scientific studies are now showing that they play an important role in creating precipitation. Microbes from the soil and plants can go airborne and facilitate a process called bioprecipitation. These microbes include bacteria, fungi, and tiny algae. For a cloud to produce precipitation that falls to the earth as rain or snow, ice particle formation in the clouds is required. Just a decade ago, it was thought that only small mineral particles or other inert particles could serve as nuclei for condensation to occur. So how cool is that? Like a nucleus gathers together water molecules and like kind of calls them in as a raindrop, and clouds move them over to other parts of the world. And it says that the evidence is building that vegetation and soils are a crucial source of atmospheric biological ice nucleators in precipitation. They may, in fact, be the most efficient ice-forming catalysts in precipitation, not airborne mineral products. Minerals being just, inert, like non-living, nutrients. These rain-making microbes are significant influencers of the water cycle. They can also travel long distances in the atmosphere for dispersal on a global scale. So, before we go making overarching conclusions, and I feel like this is a big shift in consideration, right? This is information that I don't know about you guys, but like, I studied, my master's degree is in public health. I studied infectious disease. I actually wrote a paper. I couldn't find it tonight. I have to find it. I literally wrote a paper about what to do, inciting compliance in the face of an influenza pandemic in 2006. So I have come from the consciousness of I cough, you get sick disease paradigm. But, I have to say, when I was seeing everybody like spraying Lysol like it was some heroic health effort, I thought I don't know about this. Is this really worth it to be poisoning ourselves and shutting off our healthy breathing cycles and, judging each other and, all of kind of the negativity that's been thrown around, again, without really being on a side. I don't even watch the news, you guys. So I'm forming these opinions and looking and finding evidence. And like this study that I mentioned earlier, this isn't like in some random journal. This is the Journal of the American Medical Association, JAMA. It's like the premier medical journal. And it's a study commissioned by the U.S. Public Health Service. This is not just like, you could, I don't know if you can, if you actually look up the researcher's, his career, he was a celebrated, and still to this day, a celebrated role in this country's history of, understanding disease. So I just think it's interesting. I think there's information that maybe we haven't brought in. And I'm not here to say that there are nefarious reasons why not, or why it's been shut out or anything like that. That is not at all what I'm saying. What I'm saying is that, it's just maybe we should reopen this conversation. Maybe this should be up for discussion, because if I look through Syntropy, which is how I've committed my life, I am allegiant to the idea that I want to live powered by love. I do not plan to live powered by fear, and not to vilify fear, but I just really want to, I want to be curious. I want to learn. I want to assume that I don't know things. I don't want to just generalize that I know something and then act based on it and judge people when they don't act based on it. So, in Syntropy, life is about cooperation and adaptation. And I have seen incredible things in the space of healing. I have seen some of the most susceptible people in the grips of fear that their body couldn't hang in with an illness. And I have seen them heroically not only get through it, but be better for it. And that, I can share more of going forward, because I see this is a part 1 of this discussion. There's a part 2 and a part 3. There's a ton of information about germs. We just the word, kind of the colloquial word we use for microorganisms or microbes. And if we really go into that, into the viruses and the bacteria and the fungi and the parasites and the protozoa, they're fascinating when you look at their function in life as essential parts of life, how it evolves, how it adapts, and in nature, in us, because we are nature. It's really fascinating. And then the part 3 to me will be about infection, because there's some really fascinating stuff about the importance that infection plays, even in chronic disease, even in cancer. So anyway, I hope this sets the stage for us to really sink our teeth into this, because I would love to just see this be the stimulus for some really interesting conversations, and less claiming and more questioning. That's what I would love to see from this.
So beautiful, Marissa. I really love it. And that's one of my greater takeaways when we look at the stories that we have grown up with, what we read in textbooks, what was, I guess, professed to us during our time that we went through what we would call schooling, that's what we assumed to be established fact, therefore maybe truth. I never really questioned it like that prior to falling into the syntropic agroforestry expansion and the renewal of my own ability to not just think for myself, but to get that innate curiosity reactivated, and being able to dare to lean into a perspective that isn't part of what I have known. So thank you for bringing this up. And for me, in the essence of it, this is a conversation, so to speak, between what could be, I'm not really into theories, but this realm of called terrain theory, and then germ theory. And so there are those two different, and what really happened when we started believing in germs being the cause of, and how true is that really when we really look into the essence of it and the substance. And could it be that we've based the whole range of our research orientations and medical orientations and now policy making orientations and government decision making, schedules and schemes and you name it, who knows, we may actually find that we are holding the wrong end of the stick, and we have been doing that for a very long time.
And that's okay, right?
That's
okay. It's always okay. My husband reminded me tonight, he used to, in his talks and, in the fitness world, he used to always say when he was presenting some kind of newer research or newer perspective, he would say, I reserve the right to change my mind. I think, a mentor of his used to say that too. So, that's what I love. I would love to see humility brought to the table. I see a lot of this is just how it goes. This is the way it works. One of my, old friends who I actually mentioned in my illness discussion last week, he commented on the posting for this talk and said, because I said, what does nature say about how disease spreads? And he said, nature says that disease exists and that, the disease that shall not be named on the internet without getting canceled does exist. Right. So I had so much compassion in that moment for him, because he assumed that he heard that I was saying that disease doesn't exist, or that I'm denying that the suffering that is going on exists. Look, guys, one thing I will tell you, I have been helping people and caring for people, genuinely wanting them to be as healthy as possible, to take away, if I could, to pull away their suffering, if I could physically pull it away. I have been doing that for a very, very long time. I went into this field to help others and to help myself, because I suffered. I knew what it was like to be sick, to not feel well, and not only not feel well, but to feel susceptible, to feel that deep fear that maybe I was more susceptible than others, and that I would get, and it honestly, it was true. I would get the worst of everything. Like some people would get sick, I would be like the most sick, or the sick the longest. Like I've definitely been there. And for those who have had more serious illnesses than me, I am not here to downplay your experience, to denigrate any of what you have gone through. In fact, just the opposite. Here I am looking at this information thinking, wow, guys, we get to widen the lens and open our minds now. We get to look beyond this, perhaps, this a misinterpretation, or at least an interpretation that was so limited that there were only just so many actions that we could take from that perspective. Now, if we widen the lens, if we do what you're saying, Sovereign, where we examine, terrain, meaning like our environment, what else could disease be caused by, or be about, that we can learn about and take action from? And there are so many actions, you guys. I've been there. I've been in that narrowed place where I only had this many things. And the answer for me from my physician was, you've got to go on this medicine forever. And several medicines, actually. And I was like, I feel horrible. No, thanks. And then I was like, off on my own, cut off, like, okay, I got to figure this out, I guess, because I kind of want to feel good and enjoy my life. And it was the most amazing experience for me. Even the suffering, because jumping into natural health, I'm not going to lie, is like, sometimes it's like, you're like, where's my life vest? And, you're just trying things out, herbs and all that stuff. That's why I'm telling you, and I'll go into homeopathy down the road, but man, what a miracle that was, because it's not the same as what we think of when we think of holistic health. It is a full system of medicine, and it's been around far longer than this whole theory has been around. So anyway, yeah, I'm super excited about the possibilities here. And I'm so grateful for everyone who showed up to this and who's hung in. And I'm going to ask you for something, though. I'm going to ask you to please share this, because I would love to bring more people in to a community of just not critical thinkers. I don't even want to reduce it to a name, free thinking, critical thinking, just curious individuals who want to pursue better for everyone that we love, for even people that we don't know. I want better for everyone. And I think that this is the way to do it, to just start to go, this whole thing that I thought was absolutely true, it might be time to start questioning it and just see what happens if I take in other possibilities for what might affect my wellness, and focus there and see if maybe we tend there, we get some better results. Because I know, at least in this particular pandemic scenario, we're 2 years in, guys, and I don't know, I'm not really that thrilled with the outcomes. I wasn't, frankly, that thrilled with the medical outcomes before. I've been following the mortality rates for quite some time now. They were drilled into me 15 years ago. Like, it hasn't been looking good, and it hasn't been getting a whole lot better. So, and again, I say that with absolute compassion and kindness towards those who are heroically working in the healthcare field. I mean, I really genuinely, I share your interest in helping people be well, but let's maybe see the value in opening our minds to taking in, different information and doing some different things with it. So, all right, that's part one. So on that note,
Wow.
all right, so next week is germs. we're getting into germs. So join me for that. I've got some really cool stuff to share with you. So I'm very excited for that. And I just thank you so much for joining, Sovereign. Thank you.
Yay.
I'm sorry for blabbing the whole time and not giving you a chance, but you did to share your wisdom at the end.
As the Syntropic sage, I just want to remind people of the stuff that they already know, that we are all an intrinsic part of nature, and we are an interconnected field, a web of life here on the earth. And the influences that we are experiencing from the macro to the micro, from the individual through to the collective, are not separate events. And because everything in life's performing a function with purpose, we as unique individuals get to explore what might that function be. Oh, wow, I got the word that can't be mentioned on live streams on these platforms, and so it shall not be named. And what did it do? What function did it perform? And what I really loved about what you shared is how to lead a life from love, as opposed to leading a life from fear or operating from that frequency that is more about prevention. How can we cultivate within ourselves by opening up? And that takes courage, that takes bravery. And this is what I would really like to invite anybody listening to this to join Marissa and me. For as long as I'm sitting on the side as the Syntropic sage, I would really like to invite you to come on this journey, because it's one of direct inquiry and questioning into assumptions that we may not even knew that we had about life, that actually have no basis in reality. And that sounds bold, but this is what the Syntropic lens really provides us, is a recognition that what we think is reality actually doesn't exist in the living metric of life. And if it doesn't exist in life, then it must be an idea that we've created which shapes a perception, but it doesn't change how nature actually operates. And so nature, therefore, being the kind of backdrop, but also the foundation and the groundwork upon which we can build our perception, allows us to broaden our engagement with ourselves, with each other, with our old beliefs, with potentially renewing some of those. And that takes courage. I know that takes courage. So I want to invite you all to consider that in the least.
Beautiful. All right, you guys, that's it for us tonight, and we'll see you next time.
Yay. So beautiful. Ciao.
Ciao.